I can't tell from the Zoom list exactly which board members have joined us, but I do know that we have Dr. Ben Shadler here in the room with us, and we have another member, Sue Hume, joining us remotely, which establishes quorum for this meeting. This meeting will last about 1 hour. After we ask Dr. Hartman for his report to the board on the mask order, we will open the questions to the board members. Again, that's the purpose of this meeting. But then we'll go beyond that and ask folks to type questions, members of the public or elected officials, to type questions into the Zoom box, and then give Dr. Hartman an opportunity to answer questions relating to this mask order. Again, the purpose of our meeting today. If you have questions about COVID-19 in general, or the virus, the statistics, that type of question, I would recommend that you go to the Wyoming Department of Health website. And if folks out there have questions about the constitutionality of Wyoming's public health statutes or the board's actions, I'd ask you to please contact or reach out to the Wyoming Attorney General's office. Ultimately, they are responsible for some of those issues, and those are the folks that our state and our local board, whose advice we rely on, as well as our county attorney. So with that, I would like to ask Dr. Hartman to report to the board on the status of the public health order.
Okay, good afternoon now. It's 2 minutes into the afternoon. As everyone knows, 7 days ago at its regular meeting, the Laramie County Board of Health directed me to draft a mask mandate for Laramie County. And the reason for this is the steep climb in cases, positive lab positive cases, admissions to the hospital, increasing numbers of patients severely ill in the intensive care unit requiring life support, and looking at the surrounding states, the situation looks pretty unnerving. Hospitals in Montana, South Dakota are starting to reach maximum capacity. The hospital in Casper has reached maximum capacity. They are getting to the point where they cannot take transfers from other facilities of patients because they're out of beds. We're still in pretty good shape here in Cheyenne in terms of resources, medical resources, but nonetheless, Cheyenne Regional Medical Center is currently treating 21 patients who are admitted because of COVID-19. 15 of these patients are in medical units. 6 patients are in the intensive care unit. 5 of them are on life support. And when I say life support, what that means is that they have a breathing tube inserted into their airway. They are under general anesthesia. They are connected to a machine that breathes for them, and they are being managed by a physician who is a specialist in critical care, and they're being attended by ICU nurses, respiratory therapists, etc. Some of the patients who get into trouble with COVID and end up on life support are often on life support for a long time. Many of them come off, some of them don't. We're better at treating these patients now than we were at the start, so the chances of surviving this type of an event are greater now than they were, but nonetheless, it's not a good place to be for the patients or for the population in general. What we're worried about if trends continue is exhausting the resources of the hospital, and we don't want to have to get into situations where we have to make some very, very unpleasant decisions about treatment. So let me talk a little bit about the order. We have used as a template the order previously approved in Teton County by the state of Wyoming. And as Mr. Thorson said, these orders are scrutinized very, very carefully, not only by the Laramie County Attorney, but also by the Wyoming Attorney General, scrutinized very carefully for constitutionality and legality. And so by the time these orders are looked at and by the time we release them or roll them out, they have been looked at under a microscope by a legal team. And that's just to address the questions that always come up about whether they're constitutional and legal. They are. But further questions can certainly be directed to the Wyoming Attorney General's office. Here's what the order will call for. And it's probably not as draconian as some people are imagining it will be. In fact, a lot of what I'm going to say we're already doing in many places in Laramie County. The order will be directed not at specific individuals, but largely at retail establishments, commercial businesses, and commercial establishments, or any facility open to the general public, including some governmental buildings. The order will require each such establishment that is open to the general public to have clear signage at the entrance stating that face masks are required for entry. And those establishments will also have all of their staff that interact with the public wearing a face mask. And I'm going to talk a little bit about face masks and how they work shortly, because I know there's a lot of misperception out there. The order will cover also persons waiting for or riding in public transportation or paratransit, or while they're riding in a taxi, private car service, etc. When people are outside, adequately socially distanced, when they're attending private events, etc., the order does not extend into those realms of life. Any person who casually goes around town and goes to many of the stores will see that a lot of this is already being done. My wife and I drove around this morning for a little while just to see what some of the local stores are doing. We started at Menards, then circled back past Walmart, Sam's Club, then through the rest of some of the other shopping areas. And virtually every single business has signage out front stating mask required to enter. And I've been in many of those, and they also have their staff masked when they are dealing with the public. So one might ask, well, if so many businesses are doing this, why the order? Well, the reason is that while many businesses are doing it, many organizations are doing it, many are not. And because of the rise in cases, we feel that it is in the best interest of public safety to have an order such as the one that we will hopefully be signing this afternoon to make the practices uniform throughout the county. So masks. Masks work by interrupting the flow of droplet-laden air between people. This is a highly contagious disease that is transmitted person to person through the air in small droplets, varying size of droplets. The virus, just as a virus, doesn't travel by itself, but it has to be in droplets. What the masks do is they interrupt the flow the velocity that they're exhaled, the rapidity with which they move through the air, and masks, when they are most effective, are combined with other methods such as social distancing and hand washing. The reason that we know, and there's really no debate about this in the serious medical or scientific literature, masks protect both the person wearing the mask and people around that individual. Most of the spread of this virus is by people who have few, if any, symptoms. So it's not the people that are really sick that are spreading it, it's the people that are out there circulating in the public who do not know they have it or do not suspect they have it. They are infectious and they can infect others. We hear the argument all the time that it's my body, I should wear a mask if I want to, but I shouldn't have to. Well, if the decision to wear a mask only affected the interests of the person wearing the mask, we wouldn't really care. Well, we would, but we wouldn't be worried in the same sense that we are now. I like to compare it to smoking. If someone wants to smoke, they may do so. It's their right. But it's my right not to have to breathe their smoke. If someone does not want to wear a mask, they can choose not to, but I have a right not to be exposed to viral droplets that they are shedding into the air. So it's not all about the person being asked to wear the mask. It's about the people around them. And by refusing persistently to even consider putting on a mask, I think you have to consider that you are at least exposing the people around you to at least the possibility that they may end up sick and in the hospital. There are quite a number of exceptions allowed in the rule. There are exemptions for certain types of medical conditions, and I can't really enumerate all of them. If a person there are rules for restaurants, for example. Obviously, you cannot eat with a mask on, but during the phase of entry into the restaurant, while waiting to be seated, masks are required. And this is really pretty much the way it already is. So this shouldn't be anything new in a lot of ways. Medical facilities can deny entry to anyone who refuses to put on a mask. The hospital is already doing this. Various clinics in town insist on people having a mask in order to come in. Some of the individuals who have difficulty wearing a mask would be people who are hearing impaired or need to be able to read lips. There are individuals for whom wearing a mask covering would create a risk related to their work, for example. If you're working on a highway construction crew and you need to be able to hear and see what people are telling you because there's a lot of noise around, that might be one instance where wearing a mask could be a safety issue in that sense. There are other general exemptions to the mask, to wearing a mask. A lot of them are just too vague to enumerate necessarily. There are very few true medical reasons not to wear a mask. There are a few. Some people with certain types of chronic lung disease, if it's fairly severe, and especially if they have trouble with certain types of gas exchange, might not necessarily be appropriate for a mask. But really, there are very few true medical contraindications. There are some developmental conditions that would present possibly some difficulties. children under the age of 2 are exempted, shouldn't wear one. I think the Wyoming guidelines say under the age of 3. There's a lot of misinformation and disinformation out there about masks. There's plenty of websites out there that claim all kinds of terrible things to happen when masks are used. I've heard just about all of them. Let me enumerate a few of them. I've heard that they cause tuberculosis, that they put bacteria into your lungs, that they impair your immune system. There's just a lot of really weird theories out there, and a lot of it is misinformation and sometimes even deliberate disinformation. I use surgeons and operating room nurses as one example. These are people who sometimes have medical conditions of their own, but they work for an entire career wearing masks, and there has never been a credible report of anyone suffering a medical complication from wearing a mask. In fact, if you were to undergo surgery at the hospital, if you were to be wheeled into the operating room and all the staff would be standing around not wearing a mask, I would wager that you would probably feel fairly uncomfortable with that. So they are a way to protect not only the person wearing them, but the people around them. And that's why this is so important. At this time, I think I will stop. If there are any members of the board that have a question or that I need to elaborate on a little bit more, and then we can take written questions from other attendees. And we will need to stop by about 1 o'clock, so we will have time only for probably a certain number of questions, and then we're just going to have to move on.
Thank you, Dr. Hartman. And I'd ask our Zoom operator here in the room if she could please unmute any of the board members that we can identify on the call. As I said, we have Dr. Ben Shadler and myself here, and I guess I'll start with a question I have, Dr. Hartman. I think people would want to know, in the public, where are we at in that process with Dr. Harris, the state health officer, and when would you expect an order that for the public to be able to know what that is?
Okay. Well, we'll just pass this one back and forth for now. Right now, I've looked at the order. The county attorney has looked at the order. The state health officer has looked at the order. We've had quite a bit of email traffic back and forth about relating to certain questions, and it is currently with the Wyoming State Attorney General being scrutinized. And since this is almost identical to a previous order that the State Attorney General has approved, namely the one from Teton County, I would anticipate that it will not take very long to get it approved, and I would hope to have a final version, perhaps even before end of business today, and if not today, then tomorrow. In terms of when we roll it out, we need to make sure that certain key community members get a chance to look at it and get their questions answered. Those would be elected officials, business leaders, etc. And then in terms of actually rolling it out, I would hope within the next few days, after everyone gets a chance to get a preliminary look at it. But once we have it, there's no reason why we shouldn't be able to share it with the general public.
Thank you, Dr. Hartman. And I guess the next question, I don't know if this is it's got me, but that's fine. I don't know if this next question is more appropriate for you or for our executive director, Kathy Emmons, but once the order is certified, if the order is certified by the state and is released back to us. I understand that there's an emergency operations center call coming up where we'll be able to have that conversation about enforcement, and folks will be able to know what it, hopefully we'll have the order in time for that call. But what would our next steps be, Kathy?
Mr. Chairman, that's correct. We have an emergency operations center meeting this evening at 5:15 for the EOC members and the elected officials. And then at that time, we will give a status update as to where we're at. If the order is signed after that meeting, then we will convene another meeting of that group to make sure they're aware of it as soon as it's signed.
Thank you. Right. Other members of the board, Dr. Binshadler, do you have any questions for Dr. Hartman?
Not at this time.
Okay. Sue, I see that you're unmuted, and I hope that you're with us on this call. Wanted to ask if you had any questions for Dr. Hartman at this time.
I do not. Thank you.
Okay. I think then we have a couple other board members that I frankly don't know if we have on the call. I think, as I understand, they couldn't join the call because we have a limited number of Zoom spots or maximum participation in the call. Of course, if those board members have questions, they can just reach out to me, and I'll make sure that those get to Dr. Hartman. Kathy, again, this is a question. It's part of this update or the report, but if you could speak about what are the numbers we're seeing in the community now? We were, when the board made this decision last Tuesday, we had information about some of this information, and we've seen those numbers change somewhat over the past week since. So with that, Kathy, do you?
Thank you, Mr. Chairman. Yeah, I have some the updated data, which is up on the screen. When we look at the total number of cases in Laramie County, just in the month of October, the first week of October, we had 54 cases. The next week, we had 114 total cases. October 19th, we had 154 total cases. And then just this week, as of Monday, we had 245. So you can see there's a significant increase each week just in this month as far as the number of cases. As of Friday, the 23rd, 7.24% of all tests that were administered in the last 2 weeks were positive. That compares with 5.28% just last Tuesday. So again, that's a significant increase. 28.76% of all cases in the county are due to community spread. Last Tuesday, we had 1,978 contacts. This week, we're up to 2,154. When you look at the number of lab confirmed, we've had 1,143 lab confirmed positives and 350 probables. And probable, again, is individuals who have had close contact with a known positive and are now symptomatic. We have, so the total of that is 1,493. So last week, we were at 1,227. So that's a jump of 266 just in 1 week. When you look at the number of recovered, we had 727 lab confirmed people have recovered. 217 probables have recovered. So that's a total of 944, which we're glad that that's up from the week before, which was 842. And we've had 6 deaths in the county. So if you look at the number of active, and the active cases are the total number of positive minus the recovered, that comes to the number of active people in the county. We have 416 active lab confirmed cases and 133 active probable cases. So right now we have 549 active cases in the county. That has climbed from 379 last week. So that's a difference of 170 individuals. So again, you can see that those numbers are continuing to rise fairly significantly. And we have had, like I said earlier, the 6 deaths. And as Dr. Hartman mentioned, we right now have 21 in the hospital. Yesterday we had 20. 15 of those are in medical. 6 of them are on ICU and 5 are on vents. And the number of patients who are in the hospital has gone up every single day for the last 2 weeks. It's not just a random every couple of days. It's every single day we have seen an increase in the number of individuals hospitalized. When you look at the positivity rate for the county, 7.24% is our positivity rate, which is considerably higher than where the goal, which is about 2%. So again, we are significant there, and you can see the spike that we've experienced since September. About the middle of September, things started going up, and they show no signs of slowing down at this point. So that's the data update as of today from a week ago.
Thank you, Kathy. I think it's important for the members of the public, again, to hear from us in an environment, to hear from Dr. Hartman about the status, the update, the update on the status of the health order. But we also think it's important for the public to be able to understand the information that this board received a week ago and where those numbers are trending. Dr. Hartman, did you have anything to add to that?
Yes, I do. One of the things that we frequently hear are statements like, this is no worse than the flu. We're not doing all this for the flu. Or people die in car wrecks also, but we're not doing anything about car wrecks. So I just want, and we've had very few, relatively speaking, fatalities in Laramie County. Kathy mentioned 6. And people might say, well, gee, that many people die in car accidents. But let me give you some national figures that might put some of this in perspective. And let me say, first of all, that we've been fortunate up to now in Laramie County that we haven't had more problems with this. As of right now, nationwide, COVID-19 is the 3rd leading cause of death behind heart disease and cancer. It is ahead of preventable injuries. It's ahead of the combination of influenza and pneumonia. We have some recent mortality figures comparing death rates from influenza and COVID in the U.S. over the last couple of years. For example, during the 2019 influenza season nationwide, about 22,000 people died of influenza. So far this year, 10 times that many have died due to COVID-19. In Wyoming, in terms of hospitalizations, we asked Cheyenne Regional Medical Center to tell us how many people were hospitalized last flu season due to influenza and how many they have hospitalized so far this year due to COVID-19. During the 2019 flu season, Cheyenne Regional Medical Center admitted 20 people with influenza. So far this year, they have admitted, this is not the most recent number, but I think it's 93 or 94. So almost 5 times as many as in a typical flu season have been admitted so far this year, and the year's not even over yet. So what this all boils down to is that a lot of people try to minimize this. They come up with all kinds of statements such as, well, it's just not that bad. Why are we making a big deal out of this? But it is a big deal. Well, most people that get this do well with it and don't have significant problems. There are significant risks of not only of mortality, but of morbidity, disease-related issues. And we're finding that a lot of people that get this, even after relatively mild infections, have persistent symptoms that last a long, long time. So this is not a disease that anybody should be blasé about or feel comfortable or say they want to get.
Thank you, Dr. Hartman. We want to have time to take questions from the public, and I would ask Emily if it's possible to increase the size of the chat box so that we can see those, and that Dr. Hartman hopefully can see them from across the room.
I'm going to have to stand up there. I can see them from here.
Sure.
Go ahead and use that small mic.
Okay, yeah. And while you're taking a look at those, and again, I'd ask you to please, our purpose here today is to answer questions about the mask mandate or the face covering order, et cetera. And that if folks have questions about COVID, or I was able to see part of one up there about, well, what are we doing about cancer and heart disease? That information is out there in the public sphere. National Institutes of Health can answer those questions. The Wyoming Department of Health website can answer a great many of the questions. We're asking Dr. Hartman to focus on the mask order, because that is the purpose of this meeting. And Dr. Binshadler, yes, I mean, out of your way here.
I just wanted to bring up the issue that relates to the business community and what we've tried to do to think of their interests to the best of our ability and reassure the public as best we can that we have approached this in as balanced a manner as we possibly think we can, and will attempt to have as few punitive and other kinds of things that come up about penalties and arrests and the law enforcement issues and such that we have clearly had go through our minds and have considered with regard to this issue.
Thank you, Dr. Binshadler. And
Mr. Thorson?
we're going to, excuse me.
This is Sue Hume, if I can say something when there's a minute.
Oh, yes, so your board member, absolutely. That was our priority, was to have a chance for board members to ask questions or to talk to Dr. Hartman. Yes, please go ahead.
My thoughts are, and we had talked about this, is we are not trying to shut anything down. We're trying to keep businesses open. And I have been involved with some other agencies that I cannot share because I don't have their permission. But this agency I'm speaking of has had to close down 2 or 3 times because of staff becoming positive with COVID-19. And if we can do something to prevent that so that these businesses can continue to function, then I think that that's something we need to look at also.
Thank you, Sue. And I think that, I know that was part of the consideration that the board put into this prior to passing its motion last Tuesday. And a big part of our conversation, hearing both from, the folks that have been working with the business community, with the Chamber of Commerce and the elected officials from the very beginning, and also from the health department staff that have been working with individual businesses, trying to help them to stay open, stay safe, stay successful. So yeah, thank you for bringing up that point. Again, we're going to ask Dr. Hartman to answer questions in just a moment here, but I do want folks also to know that they can reach out to me. I know that I had the experience of what it's like when somebody puts your home phone number out on Facebook last night, and I think our whole board did. And that may not be the best way to reach us, but I've been asked by the county commission to answer people's questions, and so that's what I've been doing for several days and will continue to do. And I'm happy to stay on this call for some period after the meeting concludes to answer questions that, again, they may not be directly about the mask, but it not just answer questions, but also hear what people think. Because I think our board, and I want to thank you, board members, who have been fielding these calls at home and at work and everywhere else. And also thank the members of the public who are paying attention to this and getting involved after, a career sitting in public meetings, hoping that somebody from the public would actually attend. I think the folks who are getting involved really need a civics medal if we had such a thing, because that is so important. And for us to make these kinds of decisions, we do have to hear from all sides, and we have, and we heard from all sides in our last meeting on Tuesday, and we'll continue to do our best to invite those comments and to respond to those questions. But with that, Dr. Hartman, I think you're the star of this show. If you would be, you've had a chance to look at some of the chat questions.
Okay. I never wanted to be a
This has to be on as well, and then
Maybe I should just take that.
I think you should take this up there. We really want people to be able to hear you.
Okay.
That's important. Thank you.
Okay, so, yeah, a lot of people are wearing masks, and I'm really happy when I go to the grocery store, and I do a lot of my shopping at Albertsons on North Yellowstone, and quite a few people are, but we realize that we could always do better, and most of the modeling and predictive analysis of mask wearing indicates that the higher you get to universal compliance, the better the outcome. And one of my favorite examples is actually another country, Taiwan. It's an island, small island, not too far from China. It's not a communist nation, it's a capitalist nation, but it's very high population density, 23, 24 million people crammed into about 2,000 square miles. And they tried to keep COVID out of that population because you would expect that in a densely packed population like that with no immunity, that it would spread like wildfire. Well, it just so happens that in terms of their culture, masks are just not a big deal. They just put them on. They don't argue about it. They don't make a big issue out of it. And so far, they have had a little over 500 lab-confirmed cases and 7 deaths. So it's a real-life experiment that shows how high mask utilization can really have a beneficial effect in terms of slowing down the spread. Let me look at some other. Oh, what is the exit trigger for this order? That's a great question. And I actually got that same question on the phone today. I didn't actually talk to the person that phoned in, but I listened to his message. And the way he put it is, what will success look like? How will we know? Do we need to wait for a vaccine? So let me just talk about some of the metrics or some of the criteria that we're currently following in Laramie County. And there's 5 of them, and I'll explain what they are. The first one is what we call the epidemic curve, which is just a graph of whether cases are going up and down. Then there's the ongoing count of laboratory confirmed cases. Then there is hospital bed utilization, hospital intensive care utilization, and the percentage of all tests that are positive. Unfortunately, right now, all three of those are going up. So the first, my first answer to what will success look like, and I'll elaborate on it a little bit, but it will be the opposite of what we're seeing now. We want to see everything be coming down, and it will certainly be very beneficial when we have one or more safe, proven, FDA-approved vaccines that we can use. I can't give a specific date, but we do continue to follow the metrics, the 5 that I just mentioned, and as soon as we see all those start to come down, I think that would be very beneficial, and we would look at the appropriate time when we could take away the mask mandate and get back to more normal life. Okay, so let me see some of the others. Some of these are just philosophical questions. And
Dr. Hartman?
yes.
Sorry, I just saw a question up there from Commissioner Heath, who is the county commission
Right.
to the Board of Health.
Right.
And Linda's question related to, I just saw a question from Linda Heath, one of the county commissioners and the liaison of the Commission Board of Health. And she was asking about the effect the order would have on worship services.
Okay.
If I read it correctly.
And I saw that too, and that's a great question. That's a fantastic question. Faith-based organizations, including churches, Catholic or Protestant, synagogues, mosques, kingdom halls, have for several months now been specifically exempted from the statewide orders. They are exempted from this order. They are not, let's see what, I'm blocking on the right words here. They're not retail organizations. They're not necessarily open to the general public in terms like say a museum would be or something like that, although many of them are very welcoming to people. But we have not included them because they have not, for the last several months, been included in the state health orders. I've actually talked to the Cheyenne Interfaith Council several weeks ago. We had a very nice Zoom meeting, and I've talked to a number of other pastors of various churches, and to their credit, all the ones that I've communicated with, even though they are not obligated to do so, are taking this very, very seriously. They are using as much as possible the recommended measures to keep their worshipers and their clergy safe. There is guidance on the Wyoming Department of Health website for religious and faith-based organizations. It covers a lot of different types of recommendations, but the thing to keep in mind is that the virus doesn't care where it is. It doesn't care if it's in a bar or a church. And so we certainly encourage all faith-based organizations to continue to follow the other guidelines as much as possible so that they can keep everyone safe. Let me see. Let me think. I've already covered the metrics for the mask mandate. I just went over that. There's a philosophical question about government overreach, but we've talked about that. These have been looked at by the Attorney General and the local attorneys also, and they can take that question to either the governor or the Attorney General. Let me see. Let me look at a couple of these others. There's someone asking me to go over the entire mandate again. I don't think we have time to do that. It'll be released soon. I just don't want to go over all that again and again and again. With due respect to the person who asked.
Pardon me, Dr. Hartman, also really won't know what the order says until it's released by the state health officer. If we can change or modify it.
Yeah, there may be some modifications. We have a pretty good idea, and I've already gone over that. I just don't want to take the time to do it again. Let's see. What exceptions will be made? You know, I think given the situation that this person is asking about, I interview children who have been abused and neglected. We have to see their faces and mouth in that interview. There's no reason that you can't have them take them. They don't have to be masked during the interview. Other appropriate precautions can be made. But no, I mean, if you have to see a child's face, you know, you can drop the mask and look at the child's face. Let's see. Children's sporting events. That's all covered in the school district opening plans. Those should all be available on the district web pages. I would urge you just to look at those there, or download them, and then contact the school district if you have any questions. Let me think. No, it does not change the school district's mandate. The school districts have mask mandates within their buildings, and this order does not change that. It leaves that untouched. So this order may be a little bit vague about, you know, when minors should wear masks, but that does not apply to the school district. Let's see. Can we share how the mask mandate in Teton County has impacted their numbers? We have conference calls every week with Dr. Harris and the other county health officers, and Dr. Riddell, Travis Riddell, is the Teton County health officer, and he feels that their mask mandate has actually been pretty beneficial. They definitely have some cases. They don't seem to be having the steep increase that we're seeing. So his assessment is that he believes that it has actually been beneficial in terms of limiting the spread of the disease. Let's see. Let's see. I'm just looking down to see if see about the ones that are not, you know, just philosophical questions. Increase per capita help with their numbers. Again, I just answered that one. Yeah, what about out-of-town visitors to hotels, etc.? Well, you know, I think the state orders pretty much cover hotels and the hospitality industry. I think those are in order number 1. Is it 1 or 2? Yeah, there's 3 state orders currently in effect, and hotels and the hospitality industry are covered in one of those. Here's Rocky Case, City Council, I believe. What metrics will be used to relax the mandate? You know, I just went over those, Mr. Case, and gave some idea of how those will be used. I'd be happy to discuss that with you a little bit further, but since I've already gone over that, I don't want to take any more time right now, but please call me if you want to discuss any further. We have a small office, and we do not wear masks when in our individual offices, but we put masks on when anyone comes in. Great. It's absolutely perfect. That's exactly what you should do. When you're in your own space and there's nobody else around, you don't need to wear a mask. The masks have been very strict in the school systems, and yet there are cases every day. If the masks work, why is this? Well, a lot of those kids are probably getting infected outside the school. Our contact tracing seems to indicate that the transmission within the school is pretty low. We can't say it's zero, but it's low. But just because a kid turns up positive doesn't mean that they got it in the school. And in fact, we're seeing a lot of community transmission, and that's where most of the transmission seems to be right now. Let's see. Will signage be provided, or do we make our own? We haven't talked about that one. That's a good one. What do you think, Kathy? That's a great question. We just haven't thought about it yet.
So we will provide some templates for businesses or establishments to use, just like we did for the distance and staying home when you're sick and things like that. And then businesses can modify them to use their own needs, or at least have an idea of what they may want to use for verbiage.
Mm-hmm. Okay. There was another really good one there. Oh, here's a good one. How will this be enforced? Well, there are enforcement provisions, or there will be enforcement provisions in the actual mandate in terms of resources to go out and actually do that. That's going to be a bit of a challenge. I mean, the health department doesn't have enough people to go out and walk around looking at places to see if they're doing it right. And the sheriff and the police can't do that. They still have all the other stuff going on. A lot of the enforcement is going to have to be on the honor system. It will be a valid, legal public health order. Everybody will know what they're supposed to do. All the businesses and establishments will know exactly what they're supposed to do. Enforcement may be a possibility down the road, but I look at it the same way I look at speed limits. You can break speed limits left and right, and probably not get caught very often. But a couple of things can happen, and you never know. You could have an accident, or you could get a ticket. So in terms of widespread, consistent enforcement, the resources just aren't there at this time. But nonetheless, it is a valid, legal public health order, and we hope that everyone will look at it and take it seriously, because the goal is to keep businesses open, keep their staff and customers safe, and minimize the spread. And here's one. He says, actually and legally, do you believe your department has actually authority to legally enforce this mandate? Again, talk to direct that question to some legal experts, either the county attorney or the state attorney general. Let's see. Let me think. We can barely understand you with your mask on. Okay. Okay. All right. Yeah, it says Kathy needs to use the mic. What's the point of a mask order that won't be enforced? Okay, sure, that's a fair question. What's the point of speed limits if they're not uniformly enforced? That's also a fair question. You know, look, we're putting this out so that everybody knows what their responsibilities are to their patrons and to the public and to their own employees. Initially, it is going to have to be on the honor system. Eventually, some enforcement may be advisable or even mandatory, depending on, of course, how the disease goes in Laramie County. But everyone will know what's expected of them. And to some extent, we tell the different retail establishments and other establishments, here it is. It's your responsibility to be good citizens. Here's another one. We already know people who won't comply. Well, so do we. Let's see. The Wyoming statute 35-1-106 is the enforcement and punishment statute. Okay, somebody answered that. You can look it up.
Dr. Hartman?
Yes.
This is Tim. We've got time for one more question, and
Okay.
then I'll need to see if the board has any further business before we can adjourn. We can't do new business. We can do a special meeting, but we still have that.
Okay, okay. One last one. Okay, there's a comment. Many people refuse to do the honorable thing. Yeah, I'm with you on that one. But then down here is, will you also mandate vaccines after it comes out? Personally, I don't see that happening. So I guess my answer is no. Okay? So, okay. Oh, one more. Sorry, this is a great one. There's some really good questions here. I'm really glad we're doing this. If certain medical conditions are exempt, will business be expected to validate those conditions if a customer isn't using a mask? No. The answer is no. They can't. I mean, if you go into Safeway, a Safeway checker is not going to ask you medical questions. So again, you're going to be on the honor system. Now, be aware though that if you go into a medical facility, they may be able to ask you why you don't think you can wear a mask, because they're medical people and they can ask those questions. Last one. Is that it? Okay. Thank you all. Those are great questions. Sorry we can't answer any more of them.
Dr. Hartman, thank you. I know that you and the rest of the folks involved in this recovery effort are extraordinarily busy, and we really appreciate your time. I think the public had a right to hear this information at the same time as the board, or at least certainly a strong interest in doing so. So I'm glad we could do it this way. Again, as I believe Commissioner Heath added in the chat box, the phone numbers of our board members are public, and I think that's been the case for some time. If folks have questions, I know they're encouraged to give us a call, and I'm going to keep taking those calls. So, but we do want to. I would like to stress that if you call me and say that you've spent an hour talking to our executive director, or 3 hours talking to the governor's office, and an hour talking to Dr. Hartman, and you've talked to every other board member, and now you're on the phone with me. Part of why we are, as volunteers, need to be willing to hear from the public is because my time is much less critical in a pandemic than our staff's. So please reach out to us. We want to answer questions. And I'm happy to stay for some time after this meeting to try to answer any more from folks, or at least to hear what you have to say via the Zoom chat. I need to ask Dr. Binschladler and Ms. Hume if they have any further board action or motion or anything to bring before the board at this time. Dr. Binschladler says he does not. Ms. Hume or Sue?
I do not. I do want to say, for all the people who have called me, I want to thank their consideration. They have all been very kind. I've been on some boards that wasn't always the case. So thank you to those who are reaching out for also being very respectful.
Thank you, Sue. And I think we also, I'd like to thank the folks who are elected officials in our community that have been involved with this and made hard decisions about their own kind of where they stand on this issue, and are out communicating with folks, because that is their role. And we're happy to help as best we can as volunteered members of this board to also reach out with folks. So thank you all. And Dr. Hartman, did you have?
Yeah, I just wanted a couple words. I'm going to leave. I have another obligation. I can't stay, but I just want to say I think these were fantastic questions, and I'm glad all of you felt free to ask them. The questions were great. I hope my answers were equally good. Sometimes I may not know the answer, but anyway, thank you very much for your participation. We really appreciate it.
Thank you, Dr. Hartman. And with that, This meeting stands adjourned.